Next project is Healthworks. The project involved a marketing research study with regional hospitals. Presenting are Sandra Wolf-Correbo, CEO of Healthworks, Lynn Hoke, and Tyler Zucchiati, MBA graduate students from Kutztown University. Ms. Baldwin.
Good afternoon, everyone. My name is Sandy Wolf-Correbo, and I'm the founder and CEO of Healthworks Incorporated. Healthworks is a specialty company providing expert technical and nursing personnel to assist hospitals and physicians during complex cardiac procedures in both the hospital and the office setting. Our business model focuses on delivering expert staff, not only for the purposes of staffing, but also to provide training, education, and consulting on a regional as well as a national level. In a few minutes, I will be introducing you to Ms. Lynn Hoke and Mr. Tyler Zucchiati, who are two graduate students from Kutztown University who we had the pleasure of meeting and working with through the assistance of Jennifer Leinbach from ITN. We were introduced to Jennifer through our association with Connie Fowler from the Ben Franklin Technology Partners out of the Lehigh Valley, where we presented an idea that we came up with for a new remote recording and monitoring technology that could enable one of the positions that we currently staff on site in the cardiac cath lab with utilizing remote video and voice over internet protocol to actually take that position and staff it from anywhere in the country or anywhere in the world for that matter. Not a small feat when you're dealing with cardiologists, I can assure you. The concept is similar. One of the physicians that we presented to actually summed it up as, sounds like a go to my PC and a Skype all wrapped in one for the cath lab. And that's true, however, there'd be a lot more sophistication and clarity to the video and the audio component. We call the new technology hemodynamics after the technical role for which it was originally designed to source. This particular role is the only role of the three that we provide staff for that we believe could be serviced from a remote location, since it involves data collection and interpretation, monitoring and recording of the events of a particular procedure in real time, and communication between the physician and the team that essentially doesn't require the person to actually be in the room. One of the particular shortfalls in our attempt to attract funding for the development of this technology was a lack of an independent market feasibility study. We had conducted our own research that involved sitting down both with physicians and cath lab managers from our own network of client hospitals with very impressive and encouraging results that included interest from 3 of the hospitals in agreeing to host pilot sites upon administrative approval, and of course upon the development of the technology. However, with the economic downturn looming over most small businesses, money for the type of independent study we needed just could not be allocated. Thankfully, we were fortunate to have the energy and excitement of Jennifer Leinbach, who was able to arrange a meeting with Dr. Teresa Miskalka, who is an associate professor of marketing at Kutztown University, who so graciously approved the commission of an independent market feasibility study in exchange for course credit. We couldn't be more pleased with their efforts and are extremely proud of our collaboration with ITN, with Kutztown University, and of course, Lynn and Tyler. I will turn the program over to them and then I'll come back with some conclusions. Thank you.
Thanks, Sandy. Now that you've gotten some background on Healthworks technology and their concerns, I'd like to discuss how Lynn and I really use this research opportunity to help Healthworks take a look at the market feasibility of their new technology. We knew off the bat that we need to consider several different approaches to gathering our data, and we had to get a little creative given the limited budget that a typical graduate student would get for a study like this. We learned a lot about conducting market research as students, so we had a lot of techniques at our disposal, but we really had to narrow it down to something specific that would work for Healthworks. What it really came down to is how to best suit Healthworks needs. We knew that Healthworks had already spoken with local hospitals, like Sandy had just said, and that in general that reception was very positive. We wanted to do personal interviews as well, but we realized that that presented two major problems. The first of those problems is that in-person interviews can be subjective. Just like Sandy had dealt with, it's prone to bias. So what we didn't want to do was go in there and get the same kind of results that weren't going to seem independent, weren't going to seem positive. The second issue was really the scope of the study. We wanted to reach a broader area than just Pennsylvania. We wanted to see what the national attitude towards this technology would be. Furthermore, we were also concerned about time consumption. If you're familiar at all with the healthcare field, you know that it's a very fast-paced industry. Cardiologists are generally more concerned with saving lives than sitting down with a couple of college researchers to share their opinions on remote monitoring. So paying cardiologists and administrators wasn't an option given our budget, so we really had to essentially throw the idea of interviewing out. We faced very much these similar issues in conducting telephone interviews, and more advanced market research techniques such as focus groups really were out of the question as well. So what we settled on was conducting a survey over mail on the internet. We released 345 mail surveys and an additional 196 via email. This went to administrators across 45 different states. The surveys were identical for both mediums, meaning that the people receiving an internet survey received the exact same survey as over mail. We believe that this presented the most logical way of combining both what is useful to Healthworks and what is feasible given a 6-month period to conduct the study. We believe that a survey would harvest objective data, which would provide Healthworks an indication of the feasibility of its technology in a wider geographic area. Okay, so knowing that a survey was going to be the best technique for gathering information, we then had to address what information we needed to help Healthworks make decisions about their technology. And we knew we were being commissioned to see if there was a potential market for this technology, and Healthworks had already provided us with a feature list of the benefits and advantages to their technology versus the competitors who had put out prior technologies. Our research confirmed that Healthworks technology was unique. It was something that was new, something that had not been produced before. So we had this feature list, we had the product description, and we really wanted to know 3 things. The first was, are cardiac cath administrators interested in the features Healthworks is offering? The recording, the staffing, the cost savings, these are all important features of the Healthworks technology, and we needed to know how this related to administrators. Secondly, we needed to know if cardiac cath administrators believe this technology will do what it says. That becomes a big issue sometimes. And the third issue, which is really dependent on the first two, is would cardiac cath administrators adopt this technology if they're interested in the features, if they believe it'll do that job. The biggest challenge here really in developing this survey and trying to find a way to get those questions answered was understanding the terminology. When you're dealing with a healthcare field, and the cath lab specifically, there's so much complex terminology that you have to really understand to be able to talk like a cath lab administrator, to be able to communicate with them effectively so that they understand what you're asking them. To get the info that Healthworks needed, we asked a variety of questions involving administrator interest in hemodynamic recording, cost savings, remote staffing, and risk management. We also focused on how these factors specifically affected purchasing decisions, and we left open-ended questions for administrators to indicate interest or concerns in areas that we hadn't specifically addressed in the study. Once the results started coming in, we saw some interesting things. The first one was we received a response rate of 6%, which for a male survey is about average. That's not terrible. However, in order to maintain a level of confidence in our survey, we really had to be careful with what conclusions we tried to draw here. Just because of the number of surveys that were sent out, we couldn't come up with as confident results, or as many confident results as we had hoped for. Some things we did know, however, is Healthworks hit the nail on the head with what features are important to administrators. We really found that ways to reduce costs and improve risk management were important to healthcare administrators, and that's what Healthworks is addressing here. While Healthworks did a great job at conveying a feature set that's important to administrators, the main area of concern we found is that there's skepticism that this technology can be successfully implemented in the Cath lab. Several administrators indicated skepticism it could improve their lab's workflow, and others used open response sections to indicate their concerns over the feasibility of remote staffing. So now, as for what we learned and how Healthworks how Healthworks was affected by this, their idea is that they would focus on technology that would save Cath labs money and improve patient outcomes was well placed. The benefits that Healthworks Technologies is built around are the same benefits that Cath lab administrators are most interested in achieving. While this is great, Healthworks shares the concerns of many tech innovators. They have a great solution to highly relevant problems and a plan to distribute their solution effectively, but are faced with a market that is unfamiliar with what exactly they're doing. And this creates serious skepticism within the market that needs to be overcome. In Healthworks' case, the challenges are convincing Cath labs that remote staffing and recording can improve workflow, improve risk management, and reduce costs. But each innovating company faces their own version of this problem. Also, just like many tech innovators, the more clear Healthworks can be about what exactly their technology is, what exactly it's built to do, the more comfortable potential customers will be with that technology. If Healthworks continues to develop and clearly communicates how its technology benefits its customers, it will experience success. I imagine many of you find yourselves in the same situation, and it's really a rare opportunity that we can take a study like this and see its effect for so many different innovative companies. It's been a pleasure to talk to you about this.